What exactly is asthma?
Interesting question. Asthma, by definition, is a chronic inflammatory airway disease, and its usual presentation is airflow obstruction and airway edema. So let me break it down.
Please do that.
So when something is chronic, it means it has a long winding course, and inflammatory means inflammation is the body's response to injury. So, for example, when I give you a cut or you have an infection, your body will respond to it, and it's a immune system that is responsible for this response. Yeah, like the military in the body. So the inflammation is a response, and the airway is the pipes that connect the nose to the lungs. So in the human body, it looks like a tree that has been turned upside down. The stem is the trachea, and as it goes down, it gives off branches into the lungs. So asthma is a chronic inflammatory disease of this airway. Yeah. So the problem in asthma is the airway tends to be hyper responsive. For example, usual stimulants that won't cause anything in you will make asthmatics go haywire. They respond to little things that are not supposed to usually stimulate normal people, in quotes. Yeah, so the little things will trigger them. Things such as your beautiful flowers here, pollens, things like dust, animal dander, fur, especially cats, and sometimes wool. You have petroleum fumes, paint fumes. And
so different things will trigger an attack in different people.
Yeah.
Doc, from what I saw in those days, it's very scary. So what exactly happens when one gets an attack?
Oh yeah.
Because all I could tell from back in the day was they couldn't breathe, they could barely speak, and it was practically like gasping for air.
Yeah. So part of this inflammatory response is that their airway becomes narrow. So the airway looks like this normally. Then when they have the attack, it decreases to like this. So they have obstruction to the flow. So they cannot breathe well. So they have chest tightness, they have chest pains, they gasping. Sometimes can't even talk. They talk in words instead of sentences. Yeah.
Right. Doc, like I was saying earlier, it seems like people are not everybody's born with asthma. People develop it as they grow. Is that true? Well,
the pathophysiology of asthma is still not fully clear, but we have genetic components and environmental components. So, for example, we have genes like asthma run through families. So there may be a family history of maybe parents have asthma, grandparents have asthma. There's history of allergy. Children have other allergies, so they have asthma. And like I say, the gene is more like the seed, but you need to put it in the soil, water it, and all that before it grows. So the environment becomes the soil. So there are several theories
so,
now.
If I get you right, you're saying that as you grow older, it gets worse?
No, that's what I'm saying.
Okay.
What I'm saying is that you may have the gene that predisposes you to asthma, but the environmental factors to play a role. For example, there's something called a hygiene theory, where observation has shown that children in developed countries and children who are in affluent homes, attend urban schools, are raised alone in the homes, tend to develop asthma more often than children who are raised in the poor areas, because poor children, to say, are exposed to a lot of germs, and this kind of like trains the immune system to recognize foreign from self. You see, so when the immune system is not trained, when you're growing up, you're kept in a tidy place, you attended good schools, you're not exposed to germs, your immune system is sort of untrained, and therefore little things that come stimulated to go haywire. So these things are all there.
So the more exposed you are to germs, the lesser your chances of
According
getting
to
asthma?
the hygiene theory and observations made, yes.
Wow, that's very strange.
So therefore asthma incidence is higher in developed countries and richer homes. Yeah.
Okay, yeah. That's quite interesting.
So in some places, people who are living by this theory encourage their children to play. They have a sandbox for them,
right.
And then they keep animals at home to expose their children to some germs.
I see.
Yeah.
I see. Actually, exposing yourself to germs to avoid getting.
Train the immune system so that it can tell self from non-self, and they know when to fight and when not to fight. If you have soldiers who are trained all the time, they are hyper. There's no war. Eventually, they get bored and turn on the country. They want some action.
I see. Okay, so basically, genes and the environment.
Yes.
Okay. What are some of the things that are likely to trigger an attack? And you mentioned pollens and other things earlier. Dust.
Yes, dust. I saw your earlier the social thing. I saw the school was really dusty. There's an asthmatic child over there. Probably will be in a hospital every now and then because dusty environments. Sometimes woolen carpets in the homes, and you have pollen. You have strong perfumes. They paint the house fresh. the fumes of the paint. You have petroleum, and yeah, basically these are the things, and also cold, extreme cold, and sometimes after exercise can induce an asthmatic attack in some people. And there are some drugs too, such as we call them beta blockers used in hypertension, and then what we call NSAIDs, aspirin, brufen, all these things, yes, do trigger asthmatic attacks.
Okay, Doc, how do you diagnose asthma, especially for those that are born with it? Let's say for a baby, a wheezing baby. How would you diagnose? How would you know that someone has asthma if they're little?
In diagnosing, first of all, we take a history, we examine, and then we test. A history, usually, asthma in children tend to occur before age 6. It probably would have been picked up before 18 usually. And infants, when I say infants, that's children less than a year old. Most of them, 20% of them will have wheezing, but this wheezing comes with upper tract infections caused by viruses, rhinovirus and other viruses. So usually it's hard to differentiate between which is which, but they'll have a history of nocturnal cough, they cough after midnight, recurrent chest infections and all that. Now after age 6, 60% of these children would have lost all the wheezing. Okay, so they go scot-free. But
meaning they are free from asthma, or they are free from the wheezing?
Free from the asthma. So asthma will be diagnosed usually before age 6. But the problem is usually the first diagnosis, because parents usually are not willing to accept it, and you have to do a test. So there are several tests that you can do. You can do spirometry studies, you can do blood tests, several blood tests, and you can do what we call that you provoke them with an antigen or something that will cause them to have wheezing, and then you do spirometry before the provocation and after provocation. And these tests, there are other advanced studies that you can do, but basically these basic ones will point to the diagnosis, factored with the history and then with the family history of asthma too.
Right. So with the children under 6 that you mentioned that it would completely go away, is it children that have been diagnosed, before age 6, they have actually been diagnosed, or the wheezing is not actually asthma?
No, they have wheezing, but at that time we don't call it asthma, because 20% of infants will have wheezing with chest infections.
They will not necessarily develop into asthma.
Yeah, so those who have recurrent episode of wheezing, we will not say they're asthmatics. After age 6 years, 60% of them will stop wheezing. So some of them will have persistent wheezing, and they are the ones who develop asthma.
Right. Yeah. Doc, what are some of the signs and symptoms we should look out for, not just for children but for adults as well?
Okay, so there will be a history of chronic cough. They cough at night. Sometimes they cough early, before dawn, before morning, and they have trigger, maybe perfume or something, dust. They don't do too well in dust, and then they have this tightness in the chest. They have difficulty breathing, and sometimes they can't even say complete sentences. They have to say words. These are some of the things that they have allergies to. So these are the things that will point to the fact that they may have asthma. But usually they'll have one attack that will send them to the hospital for a diagnosis to be made. Yeah.
And can you kind of take us through what to do when someone gets an attack? Because I remember back in school it was very scary. We barely knew what to do with those students, and they would just be kind of gesturing for their inhaler. Is that an inhaler?
Yeah.
That's what I used to see them use. So can you take us through a process?
Yes, usually asthma requires a lot of education and patient education, because there's so much misconception on regards to asthma. Usually most asthmatics know they're asthmatics and they have their medications, but the problem I've seen in this country is there's a lot of misinformation. Most people have this fear of becoming dependent on the medication, but we have controller medication and reliever medication. Controller is supposed to control the asthma, give you a better life, and they're not prevent you from getting attacks. But most people have the reliever. They take it when they have their attacks. Sometimes you ask them, you say, we don't want to take it. They wait for the attack to
all these are drugs, these things.
Yes.
The reliever and the controller, they are drugs that you actually take.
Yes, they are like inhalers. Yeah, you pop them some 1-2 times a day. And that you have to be on this medication to control the asthma, because it's a chronic disease, like I said before. So
even without or before an attack, you are meant to inhale in.
Yes, to control the asthma. You don't wait for the attack to occur. And now some of the medications are now dual. They're both reliever, controller. So when you go on, and patients do really well on these medications. So now,
if an inhaler is not close by, what do you do? How do you help someone who has an attack?
Well, that's difficult. Well, the first step, before I go to helping, the first step is to avoid the allergens. So the person should first of all avoid these things, these animals, this dusty environment, strong perfumes and all that. But if the inhaler is not close by, they probably will have to get the patient's clothes off and free the chest a bit, let them breathe, and then rush them to the nearest health facility.
Can you give them something to drink, water or
first
something?
aid.
Is it advisable?
I don't have any evidence that shows those things. So if there's any first aid available, but then again, every facility and institution should have something like that. A first aid kit, knowing the asthmatics around, should have an a nebulizer like you earlier on showed on your set, so that they can at least nebulize before they take to the hospital. And this should do.
Doc, how serious is asthma? Can it lead to death? Can one die?
It's very serious. I actually seen we lost a patient to asthma in one hospital. He came in gasping, holding his chest, a middle-aged man, 40-something. Actually, we thought that people thought he had a heart attack, but he was trying to reach for something.
That was his inhaler.
It was in his briefcase that someone was holding. Because someone brought him in, and so the WHO records 250 asthma-related deaths annually, and it's a huge burden. It's the most common chronic disease in children, and we have about 300 million people worldwide with asthma. In the States, it accounts for the loss of 10 million school days, and it costs them $700 million to treat this. So it's a huge burden. So asthma should be taken seriously, and I must say that a lot of children are asthmatic, but they never see a doctor. So you must have a physician or pediatrician must be seeing you all the time, regular, maybe
even if you have your drugs and
you're fine. Regular 3-monthly visits. So we can check your chest, listen, do a spirometry on you, see how you're doing. You may have to modify, continue patient education, compliance. Sometimes you have to teach the children and adults how to take the inhaler. When you have an attack, there'll be fear, panic. Sometimes you lose your senses. Even how to puff it becomes a problem. And so there's a need to do training so that you show them how to take the puff in front of you, teach them how to do it. Yeah.
Is it curable?
Well, currently we don't have a cure for asthma now, but research is ongoing. We're looking at unwrapping the mystery with regards to the genetic, and we hope that in the near future we can have a genetic cure for asthma. But as it stands now, we are still, at early stages of it.
Can you live a very long and healthy life if you manage and control it well?
Oh yes, we have several medications that will help you. You can have a near normal life if you are compliant and go on these things.
In the video that we watched, I saw something about a nebulizer.
Yes.
How different is that from the inhaler?
The inhaler is a small. I wish I had one here to show you. It's a small device that you just now there are several types of them that you just get the medication expelled and then you puff it into your.
What exactly is contained in it? Is it just air or there's some medicine in it?
Yes. We have some medicines that will help. They help the airway that's been nice to open air, and then it helps. I don't want to go too technical.
Right. What about the nebulizer?
The nebulizer delivers salbutamol to the lungs, into the lungs. So that.
And is that also something you inhale? The nebulizer. What exactly
is it? It delivers. It throws aerosols, and then so you breathe it in, and then it goes there, and then it does what it's supposed to do. So that is usually what we do. Some patients have actually got nebulizers at home. Some mothers, have it, and they can nebulize their children before they bring them in. So that's also good. Yeah. So usually at my hospital we see about at least one a day, one within 24 hours. Somebody's always on the machine being nebulized. It's quite common.
Asthma is very common here in Ghana.
Yes, it is.
So you see at least one case every day.
Yeah, and the burden is increasing. From 1980 to now, we had about 75% increase in the asthma burden because it looks like we are doing well. We are becoming more urban now. So we are leaving the farm animals. We are now living in cities, posh cities, and all that. Yeah, and kids are growing up in very tidy environments.
So that means that's not such a good thing, then, is it? Becoming more urban is leading us to,
but everything has its ups and downs. So
I see. Can asthma lead to other diseases?
Well, yes, asthma can lead to other diseases. If you have long-standing asthma, we have something with COPD, and so usually you get hyperinflation, something like emphysema. And
please, can you break down those very big words for us? what kind of diseases exactly are these?
Well, usually the lungs become hyperinflated, and then people tend to develop something called a barrel chest, and it impairs what we call the perfusion, oxygen exchange. So basically, you won't be able to breathe in and get all your air into the blood out properly. And then also we have these things like cigarette smoking, prolonged cigarette smoking can predispose you to getting the asthma. So and sometimes it can one system, the body is all linked. One system goes down, it drags others with it. So it can come with a host of conditions and later complications.
I see. Is there any link between asthma and heart attack?
Well, not directly. There is no link. Like I said, the body is linked together. Yeah, but really, asthma and heart attack do not have any direct relationship now.
Right. So are there any foods or drinks or any habits that we can avoid? Like things that are more prone to give you asthma.
Yes.
Or if you do have asthma already, things that are food and drinks that you must avoid.
Yeah, sure. In general, a healthy lifestyle is the best lifestyle. So avoid smoking, cigarettes, excessive alcohol. You see, and then they use some of the drugs, some of the herbal concoctions. You never know the contents. These things may trigger attacks and all that. Now, there's also a recent study that is showing something called glutathione in asthma. It's showing that this is deficient in asthmatics. There's a whole new era of concept of medicine that's coming out now, and so basically that's. And then you try and if you know you are asthmatic, you stay away from the stimulants. So it's a lot of education. Yeah, but foods and drinks, some people may be allergic to some substances, and when they have asthma, it may trigger a whole host of allergic responses. So those who know what they're allergic to avoid these things.
Right.
Yeah.
Okay, what about exercise? You mentioned a bit earlier on that.
Yes.
Sometimes vigorous exercise may trigger
exercise-induced asthma. So some people have the attack after they do some rigorous exercise.
So if you know that you're one of such persons, you avoid vigorous.
In some places, they actually do the test where they let you exercise and then monitor you for the attack. So people know the level of how far they should go when they're exercising.
Right.
Sometimes a cold environment too.
Okay. A cold environment.
Yes, some cold can stimulate an asthmatic attack.
So how cold are we talking about? Are we talking about freezing cold or just normal air conditioners?
It depends what's normal for you, maybe normal for someone. When it's really pretty cold in there, someone can have an attack. So you have to watch and then monitor these things. If you have an employee who's with you and the person is really cold and they complain, sometimes you have to bear with them and then.
If it's too cold in an environment.
Yeah.
Okay. Right. Must you always seek medical help once you get an attack, or is it something you can just take your drugs and be fine? Just lie down at home.
You should seek medical help.
After every attack.
Yes. First of all, if you don't report the attack to your physician, as long as they are concerned, you're fine. If you had 3 attacks in a month, they didn't tell me.
Know.
I think you're fine. When you come back and you don't tell me, I never saw you, I probably will say, okay, he's doing well, continue my treatment. You see, so you have to report. And sometimes in an asthmatic attack, you have an acute response. Sometimes it can go on for as much as 7 days. So sometimes this is just the beginning of the game that you're getting.
How frequent would these attacks be?
It depends on the individual. Sometimes we have something called status asthmaticus. It doesn't remit. You must come to the hospital and treat you. It can be really stubborn. So the first attack, you have to come to us and let's check you. I mean, a trip to the hospital won't take too long. We check you, assess, okay, you're fine. We monitor you for a while and then send you back home. Sometimes we have to give you some medications or treat you there. Most people usually have their inhalers with them. And that it may be fine for a minute or two, but later on, after an hour or two, you have a much more severe attack. So you should report to the hospital all the time when you have an attack.
Right. And on the average or generally, how often or frequent would one get an attack in their lifetime? For an ordinary, not a chronic sufferer, is it possible to not even get an attack in a whole year?
Oh, it's possible. Everything is possible, but it depends. It depends on the type of treatment you're having. If you are being seen by a doctor, you're on your medications, you're complying, you probably may not have an attack. I've run asthma clinics where people have been attack free for about 8 months. 8 months, yeah. So it depends on what you're getting, the treatment you're having, and how frequent you are visiting your doctor and all that, and how you stay away from your allergens, the things that will stimulate the attack. It all being well, you could stay attack free for as long as a year or how long it takes. Yeah.
Okay, Doc. At this time we'll cross over to Studio A where Benny is standing by. I believe he has some comments from the viewers on this particular issue of asthma. Benny, what are people talking about?
Well, when it comes to the health segment, we've always got interactions, and likewise it's happening again. We're going to start off with Facebook, and our first message that we have here is from Right Reverend Father Lawrence. He says a lot of people become afraid when it happens. I think he's talking about the actual attack itself, but I normally give them garlic to sniff and it helps them too. So maybe that's a home remedy that people could actually look into. And also maybe the doctor could confirm if that actually works. Also, we have a message here from Antonio Kojo Asafo. He says, I'm an asthmatic patient. Because of this, I was a day student in SHS. I usually have my inhaler with me always, and I avoid anything that triggers it. So that's somebody who is fully aware of their asthmatic issues and keeps their inhaler with them. Those seems to be the messages from Facebook at the moment. Let's go down to Twitter, and we have a message right here. This is from Divine Kudoto. It says, back in SHS, a guy died of asthma. His inhaler finished and didn't get a new one. It started after preps. He was taken to hospital, and the next day he actually died. Very tragic. Sorry and condolences to all of you who are affected with that particular one. We have some more messages here on Twitter. This one is from El Chris Boating Eji. He says, it is really terrible. Currently a friend had an attack, and I was like, is she going to survive? And if you've ever seen an attack before, I mean, obviously the person is basically suffocating, so it can be very alarming. And Abdullah Abdul Razak says, it is indeed very terrible. So those are the messages that we've got on Twitter and Facebook so far, and hopefully the doctor can confirm about the home remedy. And if you have asthma at home, please ensure that you have all the needed things around you at all times. Back to you, Sandra.
All right, Benny, that's a very interesting one about the garlic. I'll be sure to ask the doctor right away. Thank you very much for that. Doc, somebody is mentioning garlic.
Well, I haven't come across any study that has shown that garlic...
He said if you sniff garlic.
I haven't come across any study that has shown that garlic has... Someone can have a strong odor, probably may even precipitate an attack. But there's no study that has shown that... I don't like garlic much. That has shown that garlic can be used to treat or to relieve asthma. Yeah, so I wouldn't go for that.
Okay. Doc, I know personally of a doctor who got an attack, was rushed to the hospital. She was... nebulized, or how do you say, she was given a nebulizer and then sent home with an inhaler, and since then she's never had an attack again. Is this common where people have just one-off episodes?
That's common. Once you are on the medication and you are compliant, you use it all the time, you should be fine. But then I want to point this one out. Most often we have asthmatics coming with attacks, and the first question I want to ask is, are you on medication? No. Are you on medication? Yeah. Do you have it? No. It got finished like 2 months ago. They always wait for the attack to come before they get in the refill. So I think that we should see, ask people like, do you have your car keys here? Yeah. How often do you lose your car keys? Never.
Never.
So you should prize the inhaler that you have, and you should have it with you all the time. All the time, because you never know when. You see.
And even have a spare one if possible.
Yes, you should have a spare one, like just spare keys.
Okay, Doc. Any final words of advice on asthma before we?
I would like to advise. Usually the children don't have much of a choice, but the caregivers, the mothers, fathers, they should take asthma serious, and they should make sure that they visit the doctors regularly, and then have the children reviewed, get them their medication. They should have a little education, and then we, my colleagues and I, should do more work to educate the general populace on asthma, and then try and get rid of the misconceptions they have on asthma. And people have the fear that when they use the medication they become dependent on it, and therefore when you don't have them around they might face a life-threatening situation. So that you're better off on the medication.
Okay, thank you very much for your time this morning. Dr. Bright Cheredu is a medical officer at Nabita Hospital at Community 4 Tama, and he's been educating us about asthma. This has been our health segment, and of course proudly brought to you by Lipton Tea, inspiration flowing from nature.